implementing community-led monitoring for global funds since 2019, and it has proven to be a very revolutionary and effective component of the work that we do. The CLM has enabled communities to take ownership of their own health outcomes, to also do significant investments in health, to be able to ensure that the primary health care component of all this is effective. I think that community-led monitoring is the way to go, in that it also helps to establish sustainability. Once the future is in the hands of the community, it is the way to go.
En effet, l'implication de la société civile dans le suivi des activités communautaires de lutte contre le paludisme n'est plus à démontrer. En ce sens que cette lutte que la société civile mène aide à identifier les communautés à faible accès aux soins, aider les femmes enceintes à accéder à des bons soins, mais aussi et surtout aider nos gouvernants à mobiliser des ressources domestiques pour la lutte contre le paludisme, mais aussi et surtout aider les relais communautaires et les agents de santé communautaire à être plus efficaces et dynamiques sur le terrain.
Ghana has been implementing community-led monitoring for the past 3 years. One significant change in implementing community-led monitoring has been empowering communities to monitor implementation of interventions that affect them and that improve their lives. Community-led monitoring has improved the lives of persons affected by malaria, and they are able to monitor implementation at community level. It has also helped them to collect data on implementation issues, identify community gaps, and also call on duty bearers to ensure that services are affecting them at wherever they are. One significant change that community-led monitoring has done in Ghana has been giving the tool to monitor, to identify gaps, strengthen the capacity of community members, especially malaria-affected communities, to be able to hold duty bearers accountable.
CSOM est un réseau qui réunit près de 600 OSC engagés pour l'élimination du paludisme. CSOM a développé au cours de l'année 2022 un guide de suivi communautaire des interventions de lutte contre le paludisme. C'est le tout premier guide adressé à la société civile qui traite du suivi communautaire des interventions clés de lutte contre le paludisme. Le guide des suivis communautaires des interventions clés de lutte contre le paludisme est un guide tout d'abord adressé aux acteurs de la société civile qui permet de pouvoir mener des actions et des activités de qualité dans le cadre du suivi communautaire des programmes clés de lutte contre le paludisme. Dans ce guide, vous trouverez de manière pratique toutes les étapes à suivre pour mener un suivi communautaire de qualité. Ce guide sera très utile pour développer des projets liés au suivi communautaire, pour développer les plans stratégiques de lutte contre le paludisme, ainsi que dans le développement des notes conceptuelles paludisme adressées au Fonds mondial. Voici le guide. Ce guide est accessible gratuitement à tous les partenaires impliqués dans le contre le paludisme, aussi bien les acteurs de la société civile, les partenaires techniques et financiers impliqués dans le contre le paludisme, que toute organisation ou institution œuvrant pour l'élimination du paludisme. Nous vous invitons à télécharger gratuitement ce guide sur le site de CSOM.
Bonjour à tout le monde. Bonjour, chers membres du CSOM, bonjour, chers partenaires connectés en ce jour pour notre webinaire de formation sur le paludisme dans le cadre du processus Fund-GC7. Je suis Fidel Bemado, Senior Civil Society Engagement Officer à Impact Center Afrique, qui assure le secrétariat de la plateforme CSOM. Nous sommes très heureux de vous compter parmi nous nombreux ce matin et cet après-midi dans certains pays pour notre webinaire sur le costing. Comme le thème de ce jour, c'est comment conduire un costing des activités communautaires paludisme proposées par la société civile dans les notes conceptuelles GC7 Cameroun. Et nous avons l'immense honneur d'avoir avec nous M. Chris Alando, un expert dans le domaine qui va nous édifier sur le thème proposé ce jour pour notre webinaire. Ne vous inquiétez pas, le webinaire est bilingue, dont nous avons des interprètes qui interprètent simultanément du français à l'anglais et de l'anglais au français. Donc, si vous êtes d'expression française, nous vous prions de vous connecter sur le channel lorsque le channel français, lorsque notre facilitateur Chris va pouvoir discuter, échanger avec vous en anglais. Et lorsque vous êtes d'expression anglaise, et lorsque moi je parle en français ou tout autre intervenant, nous vous prions de vous connecter sur le channel English après d'avoir cliqué sur le bouton interprétation pour nous suivre parfaitement. Donc, nous vous remercions de vous avoir connecté, de vous être connecté à notre webinaire ce matin et nous espérons que cela va vous édifier, que vous allez tirer beaucoup de leçons et d'idées pour le costing des activités communautaires. Peut-être pas seulement dans le cadre du processus GC7 qui est entamé dans pratiquement tous les pays qui reçoivent les fonds du Fonds mondial, mais également dans d'autres activités communautaires que vous menez au quotidien. Donc, nous vous invitons à être, nous vous invitons vraiment à être attentifs à ce webinaire et pouvoir poser toutes vos questions à notre expert qui est présent avec nous ce jour. L'agenda de notre webinaire se déroule ainsi que suit. Le mot de bienvenue qui est dit par le secrétaire CFOMI. Nous allons passer directement la parole à Chris pour sa session. Par la suite, nous allons ouvrir la parole à tous les participants pour que vous puissiez intervenir et poser toutes vos questions liées à la thématique de ce jour. Et après la session de questions-réponses et d'échanges, nous allons revenir sur l'importance de s'engager pour la société civile et pour les communautés vulnérables dans le processus GC7 avant de conclure notre webinaire à la suite d'une petite évaluation qui sera faite. Donc, sans plus tarder, je vais juste rappeler quelques petites règles de bienséance pour pouvoir suivre parfaitement notre webinaire. Nous vous prions de vous assurer d'avoir une bonne connexion Internet, de vous installer dans un endroit calme pendant le webinaire, de cliquer sur le bouton interprétation et choisir la langue qui vous arrange le mieux et couper le son original. Le webinaire est enregistré, donc en restant connecté, vous nous donnez votre accord d'être enregistré. Et dès que vous entrez dans le webinaire, nous vous prions de confirmer votre présence en saisissant votre nom, le nom de votre organisation et votre pays dans le champ de discussion. Nous vous prions de ne pas prendre la parole lorsque les différents intervenants vont parler et de respecter les opinions des uns et des autres. Sans plus tarder, je vais rapidement passer la parole à Chris et lui remercier d'abord pour sa disponibilité, pour l'opportunité qu'il nous offre et surtout pour son expertise dans le domaine. Please, Chris, over to you for your presentation.
Thank you so much. I highly appreciate that you've invited me here. Allow me now to just share my screen, if that's okay with you. Good. Bonjour tous. Heureusement, moi je parle anglais et franglais. Heureusement, aujourd'hui, on m'a demandé de parler anglais. Donc, allow me to switch then to English. And I'll take about 40 or so minutes to present this, or less, and then we can always discuss the way forward. Thank you very much.
Thank you.
Yes. So, it is great that we are now looking at costing at a time when other communities have already begun the process, especially in East and Southern Africa. A few countries that are going for the first window have already started learning lessons. So this document, which we prepared on behalf of the Global Fund and on behalf of Frontline, has now been changed so that it suits the needs for Impact Sante and the partners under CS4ME right now. So this is a bit different from the original one. If you were part of the first two webinars, be aware that a few items have changed based on the learning that we are having in countries so far. So I'm going to present the background of this costing and a prioritization of the costing processes. I'll take you through how to prioritize. Most of you have already been part of the national strategic planning and prioritization processes. About half or more have previously been involved in Global Fund grant preparation. And then so all you need to do now is check whether this kind of prioritization is the one you're using, or if it can help you make your prioritization better, or even if it can make you can give us some ideas of how better to prioritize. So think of that session 2 as a co-learning, a sharing kind of session. And I would appreciate your views after this. After that, we will now apply the GC7 community costing tool. This tool was originally developed for the Global Fund by a Frontline AIDS team, but has gone around the world collecting views. And we hope to also get your views from today. And then I will finalize with a bit of the next steps and take some questions. So what is the background of this whole process? You know, we've had a lot of trouble or issues trying to cost as communities. Most of the times we lose money where before we even walk into the room, when the funding split is done, after the Global Fund allocates money, we end up finding that communities have less money. The government sometimes even prefers to allocate most of the money to itself. Even when it gets to case management, where communities should be playing a major role, sometimes you find that in some of our documents and budgets, communities are really relegated. They are not really playing a full role. And this continued through NFM3. And then in the COVID-19 response mechanism, when communities had to stay home or get involved online in terms of the development of the funding request, it became apparent that communities were now at a major disadvantage. So only 16% of those that the Global Fund surveyed said that they had been involved in the costing and budgeting process. And even when they were involved in this process, they were facing serious challenges. This includes inability to master that accounting process. Most of us do not know the way that the Global Fund costs. What is unit cost-based accounting? What is activity-based accounting? The Global Fund wants us to cost based on the exact activity, where we look at the price of an item and then we multiply by the number of times the item will be bought or delivered. Sometimes we find it very difficult to negotiate with other community organizations, the CCM, the writing team that is put in place, and we find it extremely difficult to justify some activities. One of the toughest, one of the most important things to do when you're developing a funding request, and especially the costing, is to justify the activity. This justification helps you negotiate from the day you walk in to draft the CCM roadmap to the day that you're negotiating it with the Global Funds grant negotiation team and the local fund agent, the LFA. This is critical. When you had justified and you have spent 2 months justifying your costs, it is very difficult for anybody to come and tell you that it needs to get out of the budget, because already you'll have shown how this cost, this activity relates to, will impact the epidemiology of the country. You have shown that this activity is cost effective. You have shown that the activity is aligned to your national strategic plan. You have shown how it will expand the number of people being reached, and you have shown that it is not duplicated. So you have used your prioritization formula to justify that activity. It is very difficult for anybody else to come and remove it from your budget. And this is why you'll see that in the costing process for GC7, we are now highlighting the importance of justification. Already from the countries that have implemented, used the tool, we are finding that the activities that were justified well are difficult to remove from the funding request. And it is much easier for the technical review panel to remember them and to keep them in. So for the peer review sessions that have already happened for a few countries, we are finding that people or the peer review teams are very keen on the activities that have been justified well, and those that have not been justified well are finding their way out of the proposal. People are struggling to maintain them into the funding request. So justification will help you with negotiation. It will help you with engaging communities during grant making, because you will understand exactly why the activity is needed. Even if you are not the one who wrote the original funding request, when you're given the proposal or budget to implement, you will implement it as the communities already had wanted to do it. One other difficulty we are facing is that we don't sometimes understand the needs of grassroots entities. So the costing process has been redesigned so that we are able to collect information from the grassroots. If you do a survey in any of the countries, even in the high endemic zones of the countries, and you ask how many people know about the Global Fund, I would be surprised if 40% of the people or communities or grassroots entities admit that they have ever heard of the Global Fund 20 years later. And this is no surprise. Sometimes we go to the rural areas, but we meet in towns. There are very few activities such as community-led monitoring that would allow us to pick the brains of grassroots entities on a continuous basis. So this, when you do not meet the grassroots, you end up being less creative, you end up with less ideas, and you end up with funding requests that the communities are unable to help you implement. Sometimes they do not respond well to the grassroots needs. So another issue that has been faced before is that we do not put enough information on how the activity will be implemented. A lot of us assume that it will be done the way it was done previously. And if you give a funding manager a document to implement, one that was not in touch with the grassroots, and if it does not have enough information, the likely outcome is that it might not be prioritized during implementation, or it might be implemented in a different way than you had hoped. Another issue that we've seen before is that there's not enough coordination between principal recipients and CSOs that are sub-recipients and grassroots organizations. So the ideas from grassroots rarely make it up, and the feedback from the private PR rarely make it back to the grassroots. And so sometimes you have programs that are rigid. The costs cannot change easily based on the situation. And so a lot of programs that run out of funds. But worst of all is that at least 20% of the money that we are allocated, at least 20% of it goes back to the donor. And one of the major issues, one of the major reasons for that is the lack of inclusion of community programming, grassroots into the programs. Because if you look at the amount of suffering and poverty in the grassroots, I doubt whether you will see so much money going back unused. Communities usually have a need for the money, but if we just reason amongst ourselves in the towns, we might not find the best uses for this extra or this money, and we might not find as many partners that we need to implement fast. So studies in Ethiopia have shown that. Studies in other areas have shown that whenever communities are involved in programming, especially at the grassroots level, the funding moves faster. All right. So the Global Fund Community Rights and Gender team commissioned the costing tool and a guide, and Uganda has been the first country to implement it. Now, what it seeks to do is to improve how many activities from the community are retained during the funding request submission and the grant-making processes. It also wants to ensure that community engagement continues throughout the funding request. So I'll show you a few areas where a few stages of the funding request where we often lose a lot of money but do not really know it. So the tool is now supposed to help with mapping those areas where we start to lose money as communities and then correcting that situation. Thirdly, the tool is supposed to track community interventions. You know, the Global Fund Strategic Review and the Global Fund Strategy 2023 to 2028 are all talking about strengthening community interventions and making communities a better partner tracking their interventions throughout the grant. So this tool will help to track who, how, who does what, which circumscription or which constituency, how much they are allocated, what interventions they are tracking, and a few other issues. So now let's move on to our prioritization of the costing process. You might have seen this before. This is how we normally prioritize our activities. But one of the best things to do, to ask ourselves, is whether these activities are contributing to impact in terms of reduced mortality and morbidity in the endemic and pandemic zones, in terms of the number of people covered. If the people we want to cover are pregnant women and children, people living near vector breeding sites, refugees, migrants, the youth, or others, whichever we say is our key population, then let us prioritize the activities that are improving results in terms of improving the impact, that is reduced mortality, reduced morbidity, illnesses, and expanding the population that is covered. For example, an activity that is based on vector control or ensuring that pregnant mothers get pre-treatment and so on, that of course obviously helps with reducing morbidity and mortality. But also, when you extend it to the daily activities that we communities are used to, an activity that promotes village health workers collaborating with communities beyond to look for pregnant mothers and take them to hospital, beyond the health facility, of course, contributes to expansion of coverage. So when they are competing with another activity, such as buying pails or buying printing paper, of course, the buying printing paper, whether it's coming from government or communities, will not be as important as an activity that brings more women to the hospital. You've also used used another criterion for measuring or prioritizing activities. This is whether it contributes to the NSP objectives, the National Strategic Plan objectives. That is in terms of vector control. You have the government activities and your activities as communities for vector control. You have activities around case management, and then you have activities around specific prevention interventions. And some of these are basically extending services. The government sometimes does that, community health workers and communities do that, depending on your country context. But then you also need to work on those activities that remove barriers to gender-related barriers and rights barriers to any of these programs, including the vector control program, case management, and SPI programs. Then you have the whole set of community system strengthening interventions. That is interventions such as community-led monitoring. You've just seen it through this video just before as we were beginning the call. You have interventions around capacity building for community organizations dealing with malaria. You will have interventions about research and advocacy that is at the community level. And then you will have some more interventions on, there is linkages and coordination with government entities. Going forward, especially for the regions in the Sahel region that is really looking to eliminate malaria at this point, along with the others, you need more activities to raise funds, domestic resource mobilization. So the Global Fund is now introducing a new intervention under the RSSH, Resilient System Strengthening for Health, Community System Strengthening, that they're calling health financing. And under health financing, you are able to find some money to conduct domestic resource mobilization advocacy when you want. And then there is also another criterion where you need to check whether the activity is being implemented in the most affordable and quality manner. So you might need to justify based on that. You also need to check whether the activity is prioritized in the GC7 modular framework of the Global Fund. It is unlikely that if this activity is not prioritized for a certain area, it would be taken. If there's a similar activity to what the Global Fund is looking for in the modular framework, then it will be considered. Check whether the activity removes barriers and improves rights to extend services to those who do not already have them. Check whether the activity is adequately justified. And then also check if it is correctly costed. Now, the first 5, that is whether the activity contributes to improved results, whether it contributes to NSP objectives, whether it is being implemented in the most affordable manner, whether it is prioritized in the framework, and whether it extends and removes barriers and improves access, quality, availability, and acceptability of services. Those you can use at the last column of your budget to justify all these costs. You can use this on the last column of your budget to justify these costings that you implement. Now, let me take you through the stages of costing. You know, sometimes we look at the budget and think that is where the budgeting or costing of the Global Fund proposal starts and stops. No, that is not correct. We start to budget with the Global Fund during the planning stage, when the term de référence is being developed, when the TORs are being developed. That is where we start to win or lose money. Because a lot of the times we do not include community meetings money. We do not include adequate funds to facilitate dialogue amongst community members. So that is the very first place. So you have 30 people at the beginning of writing, and during negotiation you have 0. Sometimes it's the secretariat negotiating with the LFA on our behalf. Sometimes it's the PR. And a lot of the value that you put in the beginning of the funding request is lost by the end, because you did not plan for a committee that will remain until negotiation stage. You ran out of money, so you are not able to attend some of the meetings. You know, I will give an example of another country where there were now talking about, I'll give the example of another country where they were now unable to defend their funding requests at the grant making stage, not the grant making, at the proposal writing stage, because they did not bring in the people who had suggested those activities. So we had the costing specialist, who's a technical, an accountant, saying that maybe you do not need rights for adolescents. And there was nobody to defend that. Maybe you do not need rights activities for adolescents. You can imagine if you bring an accountant to cost and they do not know why you are actually purchasing, why you are actually putting so much money for residual spraying, for example. And they do not understand how to defend that, the high cost of it, either because it is in a highly dense population or a population where the housing structures are sparsely located or near the rivers or somewhere. So it is difficult sometimes to get this kind of support or technical knowledge in the costing team. That is why you need to be there. You need to budget for at least one of you to attend each and every review meeting. And for the one that involves writing of the funding request, budget to attend this meeting as all the constituencies, so that you can actually support your activities, justify them from that stage on. Another area where we lose is in the prioritization stage. We need always to verify and justify the needs of grassroots communities. At the prioritization stage, we need to have the data on the needs of these communities, almost directly from them. We need to always update our gaps needs analysis so that it informs the entire funding request, and we justify it. We use it to justify activities on the budget. The budgeting section is the easy part, because now this is where we just give the information that we have put. We fill up the priority activities in the budgeting tool, and then we give it to the costing specialist to copy and paste column by column into the global fund budget. The stage where we start to lose money again is during the review of this budget, where we meet to review with all civil society and community groups. There we rarely argue. But now we then meet with the technical review team. And in the technical review team, you meet people who sometimes are focusing on the biomedical responses and sometimes forget the community bit of the response. And then sometimes we need to ensure that the priority activities are included before we sign the funding request. In some, for malaria, you do not have this major problem. Sometimes, yes, there's a push and pull between the technical partners and the communities, but it is not major in terms of sometimes agreeing on what you want to implement. Yes, there are some disagreements during this stage, but it's not as bad. But when it is a bad disagreement and you know that the activities you have are valid. The Global Fund has now provided an annex where you list the activities that you had prioritized and then state whether they were accepted for submission. So during stage 2, when you are prioritizing, when you are having country dialogue, and you came up with this budget, if at the end of the day you only have 5% of the activities you proposed being included in the final funding request, then of course you have the right to complain and you have the right to put it in the annex of the funding request and say our activities were not taken into consideration. And a lot of countries always tend to have this issue. I remember during the funding request for COVID-19, we had to cut off $600,000 off a certain government's budget because they were talking about buying paper and printers. And yet communities did not have enough, some people did not have enough food to supplement their income, to supplement their nutritional needs. And this, we were talking about TB survivors, people living with HIV, and they did not have enough food. Same situation you'll find people, women in far-flung places who need some support to get to hospital, or who need some support to be seen in their houses. You might find that some of them will not be provided some critical services and commodities, and yet on the government side, you find that a lot of unnecessary items are being bought. So this review stage is not just to review your budget. This review stage is also supposed to help you review what the government has put in and state whether it is also justified. And if you find that it is not justified, there is an annex where you can say, we put in some activities, these were not taken yet, we feel they're justified, and yet others have been taken that are unjustified. So in this Global Fund funding request, you have an annex that will help you check for justification and for retention of activities. Finally, at the grant making and grant negotiation stage, you will need to respond to TRP questions. You will need to justify each activity again with the LFA, with the Global Fund Secretariat, the finance team, and the Grant Approvals Committee through the finance team. And then you will also need to share the final approved and committed budget with your teams and the grassroots so that you follow up on its implementation. The question is, I know we are just short of time, so we won't do an exercise here, but the question really is, if you are already implementing, if you're already drafting the process, have you reached that stage? Have you planned well? Have you prioritized well? Is the budgeting involving everybody and the grassroots communities? Are you ready for the review? Will you be enough during the review stage? Will you retain yourselves as communities during the review stage, or will you have some problems? Now, here is the cream of what brought us here. This session now just talks about how to apply the community costing tool into malaria, the costing of malaria programs. Now, of course, this will differ. Priority activities will differ from country to country from community to community. But I'd just like to highlight to you some of the areas that are being proposed or highlighted as major community entry points. Number one is vector control. You have issues in removing human rights and gender-related barriers to vector control programs. Number two is case management. And the third one as a module is specific prevention interventions. Now, interventions around there are rarely around removing human rights and gender-related barriers to the programs. The fourth area you can look at is RSSH, community system strengthening. Here, they are proposing activities that are around community-led monitoring. Whether you use the malaria, is it the malaria matchbox or toolbox? Whatever tool you use to monitor community malaria interventions, this is where you can also include it. Any advocacy and research, including advocacy for DRM, domestic resource mobilization, you can include over here. And anything to do with capacity building, promoting linkages between the government side of things and yours, promoting linkages between community entities, and then the ones between communities, government, development partners, and all. Promoting linkages between activities or interventions so that they are implemented in a more efficient manner. This is one of the other areas where you can include it. What I've seen countries do so far is highlight who their key populations are. So, of course, most countries have pregnant women and children under 5. Some are putting in young people. Others are putting refugees, migrants, and so on. And there are many other key populations, and this depends on the country's context. So allow me then to get into the tool itself that we will share with you. Some of you might have seen it already, and highlight some of the areas that we are seeing people, the interventions and what they propose for these interventions. I've put it here in French, but I hope nobody minds. This is in French. So some of the activities, like under lutte antivectorielle, the intervention is élimination des obstacles liés aux droits humains et aux genre et qui entravent l'accès au programme de lutte antivectorielle. And the activities itself, those activities that remove any potential obstacles based on gender, human rights, and any other activity that fights for vector control. Now, for example, community-led monitoring towards improved access to vector control interventions. Any activity that will improve participation or engagement of populations, key populations, and any populations that are looking to reach populations that are not as well reached by the other program, either through the PRs programs, the ones that are designed by the Global Fund, or any other partner in the country. And to bring any activity that seeks to improve responses to these obstacles. And then support for strengthening institutional capacity of organizations, of community-based organizations and civil society to fight against malaria, mobilize the population, conduct sensitization, and basically assist in community systems strengthening for advocacy or research and advocacy, and any fight against the vector at the community level. Now, anything to do with qualitative studies and evaluations, this needs to come under suivi evaluation. That is the M&D. That is RSSH, M&D, and analysis, evaluations, and use of data. That is a correct intervention where you put in any qualitative studies and other evaluations. So do not confuse the M&D aspect and the community-led monitoring aspect. So you put the community-led monitoring here. But here you just put in all activities that are supposed to eliminate all inequality and any particular obstacles to the fight against the vector, or any particular obstacles to vector control. When you get to case management, it is the same formula. So the same formula. Look at all activities aimed at removing all human rights and gender-related obstacles, either socioeconomic, cultural, or others related to human rights, and which will stop people from getting access to services. We just give an example of making sure that mothers have access to services. It might mean somebody is transported to their home, or the mothers are transported to hospital. You know, it might mean some support for those who are extremely poor, so that they are able to retain or retain ANC visits throughout their pregnancy, and so on. It might mean some of the community level ICCM interventions or others, you know. This also includes activities around continued care in the community. And these are activities in the continuum of care that are directed by or provided by the community. Other activities that will improve the participation of key populations and those that are not well covered by national programs, and those that actually help to plan and implement care, integrated care, and those that are aimed at evaluating and eliminating any obstacles to accessing case management services. The third set of activities that are encouraged here include those activities that strengthen capacity, institutional capacity, within the communities to fight against malaria, those activities that push for increased social mobilization, sensitization based on community sensitization, research and advocacy, and then care, case management based on the community, at community level. So case management at the household level. Here also, do not confuse the evaluation that is part of the M&D process with the evaluations or monitoring that we are talking about here. The monitoring we are talking about here is led by the community. M&D is usually led by government, and sometimes the community is included in taking care of the data. But we are talking about community-led monitoring over here, which looks at improved access, improved availability, improved acceptability, and improved quality of services within the community. This can be led by the community, and they can also advocate with government or inform government once in a while. So here, focus on activities that remove any obstacles and barriers to case management at the community level. The third set of activities that we are looking at are specific prevention interventions. This one talks about eliminating any barriers that would stop access to specific interventions, specific prevention interventions. Now, this is the same logic. We want to evaluate and eliminate any potential obstacles of nature, of agenda, socioeconomic, cultural, or human rights nature, and any obstacles that stop us from benefiting from specific prevention interventions. So here you can include technical assistance and planning for equitable access of specific prevention interventions for malaria after some evaluations and qualitative studies. Here also, you want to implement activities on specific prevention interventions based in the community and followed up, directed, managed by the community. Here, you're looking at activities that will improve participation of populations, key populations, and those that are not well served, and also activities that are improving national coordination, assisting to plan and implement these specific prevention interventions, and any studies to evaluate or eliminate obstacles. Here, they are also accepting any activities that strengthen institutional capacity, social mobilization, sensitization led by the community, research and advocacy, and any specific prevention interventions based and directed by communities. Again, do not put in M&D interventions here. and just focus on those interventions that improve availability, acceptability, quality, and access to specific prevention interventions. Allow me to go into an example here so that you see how one country has done it. Allow me to share an example here. So they look like they are few, but I'm just going to illustrate to you how one country has done it. So they say their key population is refugees, and they take community-led monitoring as the intervention. And so they're going to facilitate staff to conduct entry meetings, and they have assumed, provided some costs. They have listed how it will be done. And then they're saying that the reason for this is because partnerships and authorization are critical in accessing refugee settlement. So that is why they are first conducting this activity for the refugee settlement entry meeting. Then they're going to train community structures. Then they're going to facilitate their community-led monitoring enumerators, and so on. So they're starting with community-led monitoring. Then they move to capacity building to facilitate a full-day training of the members of the community structures. Then they want to conduct household mapping. Then they want to conduct regional advocacy meetings. They will be establishing some malaria smart places to equip people with malaria kits in some of the refugee settlements and so on. And then they will advocate for domestic resource mobilization. Now, in vector control, they will remove human rights and gender barriers. They will conduct continuous sensitization through religious structures. So there is so much that they are thinking of doing that. All that is in amongst refugees and migrants. So some of that might be taken, will be taken by the Global Fund. Some of that might be taken by the regional body. Then they do the same for pregnant women and children under 5. They start with some of that capacity building for monitoring, then they do the periodic documentation, then they do community-led monitoring research, and then they want to select, they want to strengthen themselves to build what you call coordination committees, and then they want to train people in malaria control. These are pregnant women. Then they train health workers as extension workers and mothers during antenatal visits. So, you know, at some place, they are also training male HIV experts to champion social behavior change for malaria control. People living with disease, with the people who inject drugs, and also others to lead malaria prevention and control activities within their constituencies, because they are receiving support for one disease, but another disease can still attack them. So they are training also those key populations of the other diseases. And then mobilizing mothers to attend ANC. So as you can see, you have only your imagination can stop you here, because the activities look as if, the interventions look as if they are few when we show them on this document here, on the PowerPoint. But when you really start to see what you can do, there are very many activities. In fact, you will now find yourself wanting to cut them, to reduce them in number rather than increase. So allow me to get to the last stage and then I'll open it for questions and answers. Here, let me just take you through, allow me to take you through community priorities, the budgeting tool that we have. The budgeting tool is an Excel tool. It's coming in English and French and Russian and also Spanish. So it provides some instructions and helps you to complete the budget. When you have a budget that is ready, then you can then, if you don't know what to put in, you have some templates already done for you that can help you insert some costs for the budget. Yeah, you can help you decide what to cost at each stage. And then you have a summary. You have the budget that is summarized according to the key population, according to the intervention, according to the disease, and in future, according to the cost component. And if you need some technical support, there's just a page where you can click, a button that you can click and get any technical support you need. Now, the budget just takes you through all these stages that we spoke about. I don't know whether you remember these stages, where we said there are these 5 stages. So it checks that you have implemented this planning stage and are ready for the next prioritization, budgeting review, and grant negotiation. Another thing it does is helps you think through analyzing opportunities, gaps, barriers, and challenges. And then it helps you then state in detail what will be done by whom, say how they'll be implemented. And if you're advanced, you can also put in quantities, unit costs, and others. But that is not really possible for most of us. So what we've done is develop a simpler tool. We are calling the community or grassroots information collection worksheet. This grassroots information collection sheet is basically a place where you describe your activity, you provide the assumptions for how they will be implemented, you state the geographical location where they'll be implemented, provide something on the quantities, but then the most important part of this is then to justify how the activity will improve coverage, impact, whether it is aligned to the NSP, whether it is being implemented in the most quality and affordable manner, whether it leads to increased number of people accessing services, and state why that activity is a priority. So this justification is critical. That is what we are saying here. And there are some examples here of how each of them can be done. The budgeting tool is, it's accompanied by a costing guide. This costing guide is useful because it takes you through each of the processes of costing. It explains in detail what I have said or summarized here. And it helps you step by step in completing the community aspects of that tool, of the work. What are some of the next steps? If you've not begun drafting, one of the next steps is to review your CCM roadmap and ensure that civil society is integrated into the budgeting process. Either you'll have your specialists or you'll have your special dates, enough time to collect data from the grassroots, or you will have enough budget to continue until the negotiation stage, so that civil society does not run out of a budget. Be ready for the internal and external reviews. Be ready for the grant negotiation. Appoint a team now that will take you through the grant negotiation stage. Appoint a team that will be there when the grant is going through grant making. I've shown you examples from that country. I'd like to show you an example of the budgeting tool. We are calling it outil de budgétisation. So allow me then to just share it with you. You share outil de budgétisation. Good. So this is exactly what I've shown you, only that you can click here to read instructions. You'll have a section on the detailed budget. You can choose to use this one to plan, or you can choose to use this one, which is simpler, the grassroots tool, to cost and to budget. You can also find out the guides for each and every intervention. So everything I've shown you here about what is accepted for malaria in the malaria grant, everything I've shown you, you can find it on this budget template. You just click one of these over here, down here, and you'll find the interventions that they accept and the interventions that are not encouraged here. If you want to know how to cost it, there we have le modèle ou le module commun. So if you're costing HIV, community system strengthening, TB, you just click here. VIH, you just click here. TB, just click here and it takes you. And if you're costing malaria, just click here. So we will provide that example, yeah, for you. How to cost each and every activity. And the examples are also included in the proposal, in the budget tool. So you can use either this detailed budget or this one here, the community tool, grassroots tool. With that, I hope at least we've started addressing some of your questions, but I would like to hand it back to Yabe or Fidel to moderate the question and answer section. I know it was such a mouthful talking for about an hour, And I'm glad at least 90% of you have managed to remain. But now it's time to listen to you, and let's see how we can solve some of the problems together. Yes.
Okay. Thank you so much, Chris. I hope you hear me.
Yes, I hear you. I hear you. You're welcome.
Okay, thank you. Thank you so much, Chris, for your presentation. Now we are going to the next step of our webinar in the open discussion. So we give the floor to all participants after this excellent presentation to ask all the questions that you have, dear member. If you have anything to ask to our speaker, Chris, it's time now to ask your question. Donc, s'il vous plaît, si vous avez la moindre question à la suite de la présentation de Chris, n'hésitez pas à lever la main. Nous allons vous passer la parole pour la session de questions-réponses. Et nous remercions grandement, vraiment, un grand merci à Chris pour cette très belle présentation qui est pratique, avec des outils simples à utiliser. Et nous vous rassurons, les présentations seront partagées à la suite de ce webinaire et en français et en anglais. Donc, ne soyez pas inquiets, vous aurez toutes les présentations. Mais pour le moment, nous aimerions vraiment qu'on puisse approfondir la question et que tous ceux qui ont des questions à l'heure actuelle puissent les poser. Nous allons donner la parole à Banzama et Sokola. On va vous permettre de poser votre question, on va vous ouvrir votre micro et vous allez poser votre question. Donc, s'il y a d'autres questions, on va aussi par la suite lire les questions du chat. Manzama, OK, allez-y.
Oui. Bonjour à tous. J'espère que vous me recevez.
Bonjour, mon cher. Oui, c'est bon. Allez-y, posez votre question, s'il vous plaît.
Merci beaucoup et merci à vous vraiment pour tout le travail que vous avez fait pour le renforcement de la société civile. Et c'est vrai que j'ai été vraiment très, très ému par les différents outils qu'on a présentés. Je voudrais savoir si, en termes d'outils, est-ce qu'on aura, au-delà des présentations, est-ce qu'on aura les outils, par exemple, les différents outils pour savoir quelle activité mettre et tout ça là. Est-ce qu'on aura ces outils? Ma deuxième question, c'est par rapport à ce qu'il a appelé le renforcement des structures communautaires. Parce que nous savons que lorsque vous recevez des financements et qu'on ne renforce pas les structures communautaires, après le travail, l'organisation se retrouve toujours au même. Est-ce qu'il y a des pourcentages requis par rapport au budget global? Quand on prend un budget global de l'ensemble de la subvention, bien de ce que vous demandez, quel est le pourcentage requis pour ce qui va au renforcement des structures communautaires? Et en même temps, par rapport à ce renforcement-là, est-ce qu'il y a des activités phares que le présentateur voudrait nous conseiller en termes de choix pour être sûr que ces activités pourront rentrer vraiment dans le renforcement des structures communautaires? Voilà mes trois.
OK. Merci beaucoup, mon cher Mansama. Je vais répondre à la première question, puis on va passer la parole aux deux autres, à Marie-Laure et à Thérèse, pour leurs questions avant de passer la parole à Chris pour les réponses. Juste pour rappeler également que les outils présentés par Chris seront également partagés. Dans le fichier Excel, où on peut aisément budgétiser les activités définies, seront partagés. Il en est de même du guide sur version Word. Oui, Marie-Laure, une minute, vous allez parler, s'il vous plaît. Donc, le guide également sur version Word qui permet de mieux comprendre l'outil Excel sera également partagé.
Bonjour tout le monde.
Marie-Laure, vous avez la parole maintenant.
Il y a un problème de son.
Question, s'il vous plaît.
Je ne sais pas si je me fais entendre.
Allez-y, s'il vous plaît. Oui, allez-y.
Allô?
Marie-Laure, nous vous écoutons très bien. Allez-y. pouvez poser votre question.
OK, merci beaucoup. Mon prédécesseur, je suis Marie-Laure Edin depuis le Gabon. Mon prédécesseur vient de poser la même question que j'ai envoyée dans le QR. Je ne sais pas si M. Fidèle peut la lire pour gagner un peu en temps. Merci beaucoup.
D'accord, merci Marie-Laure. Nous allons lire votre question. On va rapidement passer la parole à Thérèse. Thérèse, vous pouvez ouvrir votre micro et poser votre question, s'il vous plaît.
Bonjour.
Allô?
Alors, bonjour.
Bonjour Thérèse. Allez-y, s'il vous plaît.
Oui, en fait, j'ai deux petites préoccupations. Merci pour la présentation. En ce qui concerne les interventions des systèmes communautaires, il y en a 4. Mais pour aller vite à la question, au-delà des préoccupations de 2 amis qui demandent sur la quote-part réservée au renforcement du système communautaire, moi, je voudrais savoir s'il y a une proportion indiquée pour le renforcement du système de santé. Parce que nous savons que dans les différentes allocations, dans les lettres d'allocation du Fonds mondial, il a partagé pour les 3 maladies, VIH, TB, PALU, mais on demande à ces composantes maladies de donner des quotes-parts au système de santé. Or, il y a certaines activités qui sont dans les composantes maladies qui peuvent se retrouver dans le système pour soutenir les réponses. Or, il se fait que, comme l'expérience de la RDC, on a employé au RSS 8%. Avec les faiblesses des systèmes que nous avons, que nous connaissons dans plusieurs pays, je ne sais pas si c'est pour soutenir un système pérenne ou bien ça serait toujours des petites choses ça serait l'accoutumée, quoi. Ce n'est pas pour atteindre vraiment un système résilient comme le Fonds mondial le recommande. C'est ce que je voulais demander parce qu'on vous dit, et j'ai peur qu'à la fin, qu'il y ait certaines activités qui soient laissées de côté. Parce que dans les composantes maladies, ils disent, on va mettre ça dans les systèmes de santé. Dans les systèmes de santé, ils disent, nous avons déjà les activités qui sont dans les cadres modulaires, on ne sait pas. Je ne sais pas comment a été l'expérience dans d'autres pays qui soumettent au 20 mars, la semaine prochaine. Merci.
OK, merci beaucoup Marie et Thérèse. Et merci aux précédents participants qui ont posé les questions. On va d'abord permettre à Chris de répondre à cette première série de questions avant de passer la parole aux autres. Chris, over to you.
Thank you so much. Thank you so much. I'll begin. Thank you so much, Bonzama, Marie-Laure, et Thérèse. First of all, hello, Thérèse. Bonsoir, Thérèse. Ça fait des années ou des mois. We once tried and worked with Thérèse some time back. During COVID, yes.
Yeah.
But let me start with Bonzama's question. Will there be a sharing of the tools? Yes, there will be. I saw also Professor Manike had asked the same question. Yes, we'll share them. They are in 4 languages already. And I think you've answered that, my brother. And then, renforcement du système communautaire, in terms of strengthening community systems, est-ce qu'il y a des quotes-parts? That is the same question we tried to push with the Global Fund, that we must have some thresholds for communities. But you see, the Global Fund is a country-owned mechanism, really. And so they cannot sometimes impose a threshold that is workable for all countries. There are some countries that are already receiving community system strengthening money. There are some that are already receiving harm reduction money, for example. So there's really no one size fits all that will work with the countries, every country. What we're saying is going into the countries, because it is obvious that we need some community system strengthening money. We are encouraging countries to put aside a good proportion for community systems. and for communities. In Uganda, what has worked well was that we were ready with the cost for all key populations and the communities that had joined. We were ready with the cost around January. By January 14th, we worked through the holidays, we worked through Christmas, and we had the costs already done. So we told the government that this will amount to 14 or 15% of your entire budget. So out of the allocation, this will amount to this percentage of your budget. Please split it. Of course, there's been some difficulties with that, but it is a very good place to be. In that, even last week when we were being asked, what did you prioritize, and what is the justification for your priorities? We just gave the budget that we did by January, and we sent it to them and even to the Global Fund and said, we were ready last month, 2 months ago. Here is the budget we did. Here are the priorities we put, and this is what we want inside the budget. But if you are not ready with your costings, you don't know how much it will cost. When you say we want 20% or 10%, 5%, it is not as convincing as when you already provide the budget, already budgeted activities, and you say, these are our justified activities. We want 10% from you. So it is better to cost and then ask for that split, or estimate some costings and then ask for the split. That is number one. Number two, the split or the threshold, the quote-par, should be a country-led process, and the civil society within the CCM, particularly the constituencies for civil society representatives and development partners, should work together to push and request for a certain amount of money to be placed, to be split for communities and CSOs. We need to maintain the country-owned nature of it, but it has some disadvantages in that the Global Fund has so far not provided any thresholds for civil society and community budget. The other question was on community-led monitoring or community system strengthening. And I had only given examples from the malaria interventions. But on community system strengthening, when you want to cost them, we also have the model. The model put a module comma, the templates, where you can just go in and you look at renforcement du système communautaire, and you go, they're the first activities on the top. So whenever you want something to do with meetings, they're here. Sensitization, it's here. Suivi communautaire, it's all here. We've given an example from what the 7 or 8 countries under IANASO support did before. And when you want, for the TB teams that are just putting in place the CLM mechanism, they are also here. And that has been done by, who are these? Another organization, coalition, International Coalition on Treatment Preparedness. So we have some of their funded activities here. Anyway, all these that we've given here come from already funded budgets. These are budgets that were reviewed by the Global Fund financing team before, and they were funded. So we've removed examples from there. Apart from the very few innovative activities, most of these come from actual Global Fund grants. So all these you'll find under the model pour les modules communs, that is the templates. You will find anything you need. We even have one for financement de la santé, plaidoyer pour la mobilisation des ressources domestiques. For domestic DRM, you'll also find it here. So please feel free to use the tool whenever you can, and also get to the team at Impact Santé to be directed to other sources of information and support. Yeah, I hope I've answered the questions. We can take the next ones, Ibrahim. Yeah, but back to you.
Thank you so much, Chris, for all this clarification. Nous espérons que Marie-Laure, Thérèse et Manzam ont pu être satisfaits des réponses de Chris. Comme il a assez bien dit, dans les outils mis à votre disposition, on a assez d'éléments et suffisamment d'éléments pour pouvoir prioriser, autant pour moi, et budgétiser les activités qui concernent le renforcement du système communautaire. Et à ce propos, nous renvoyons également et nous vous incitons et sensibilisons à consulter également le cadre modulaire du Fonds mondial. Dans le cadre modulaire, il a été parfaitement décrit toutes les interventions qui peuvent être financées par le Fonds mondial. Donc, lorsque nous travaillons au niveau national dans le cadre du processus de développement d'analyse conceptuelle, faisons tout pour que dans notre proposition, nous ne nous éloignons pas du cadre modulaire du Fonds mondial et surtout du plan stratégique national du pays. Donc, restons focus sur ces éléments-là et utilisons les outils à notre disposition pour pouvoir bien définir les activités et les interventions que nous aimons que cela soit financé et surtout, et très important, bien les budgétiser. Maintenant, la quote-part réservée au renforcement du système communautaire dépend de chaque pays. Ce n'est pas un pourcentage uniforme pour tous les pays qui reçoivent les financements du Fonds mondial. Donc, chaque pays a une quote-part bien précise et nous vous proposons et nous vous demandons, s'il vous plaît, de pouvoir vous rapprocher des membres de votre CCM dans vos pays respectifs afin de savoir quelle est la quote-part attribuée à chaque au pays pour le renforcement du système communautaire. Sans plus tarder, je vais passer la parole à deux autres personnes. Nous avons Ousmane Ba et M. Niam Kessej. Ousmane Ba, vous pouvez ouvrir votre micro. On va vous permettre d'ouvrir votre micro et vous allez pouvoir poser vos questions. Ousmane, ouvrez votre question et votre micro, s'il vous plaît, et vous pouvez poser votre question, s'il vous plaît. Et par la suite, on va donner la parole à Jean-Paul.
Allô?
Oui, nous vous écoutons, Ousmane. Allez-y, nous vous écoutons.
Bonjour à tout le monde et merci au présentateur pour cette brillante présentation. Moi, c'est Ousmane Ba depuis la Guinée. En fait, c'est par rapport au renforcement du système communautaire. Moi, je voudrais savoir, dans le cadre de NFM4, là, quelle est la place de la médecine traditionnelle? Je vous remercie.
Merci, Ousmane. On va rapidement prendre la question également de Jean-Paul. Jean-Paul, vous pouvez ouvrir votre micro et poser votre question avant qu'on ne passe la parole à Chris.
Oui, je pense qu'il est revenu à ce que je voulais dire là, puisque vous avez tout dit, mais au niveau de la thérapie, là, vous n'avez pas parlé. Donc, il a marché sur ma langue. C'est la question que je voulais poser.
D'accord, merci Jean-Paul. On va rapidement d'abord passer la parole à Chris avant de revenir sur les autres questions. Chris, you have the floor, please.
All right. Thank you. Now, that is a very tough question. I have seen something on traditional medicine. Thank you very much, Usman. I am not very sure that I have the answer to that. What is the place for traditional medicine? Does anybody have an answer for that? Let's open that one to the board, the participants. Nobody has?
Yes, Chris.
No, I was trying to check if there is a traditional medicine, but what I see, there are some places where you can include traditional medicine. You can include the traditional healers in some of your trainings for your, whenever you're trying to strengthen the community-led monitoring, you can include traditional healers in terms of in terms of strengthening institutions, in terms of having them participate in CLM. You can also train them when you're training the police, clinicians, communities, private sectors. Then you can also include traditional healers in that training.
Exactly.
And so I'm not very sure that I'm seeing many more places, but I know that in the African context, there is an ongoing program between the the African Union, the African Development Bank, to discuss with the Global Fund its next market shaping strategy, so that it includes some of the areas that are critical for Africa, especially the issue of traditional medicine. I know that it has not gone very far, but not yet, but it is one of the issues that are coming up for discussion at the board in May, I think between May 8th and 11th in Vietnam. They'll be discussing this issue as part of the Global Fund's market shaping strategy for medicines. Yes. For now, you can include traditional healers as service providers, train them as part of service provision, and the people who are keeping the gate. But I've not seen much in terms of traditional medicine so far.
Okay, thank you so much, Chris, for this clarification. Comme je l'ai signalé plus tôt, il y a un certain nombre d'interventions bien définies par le Fonds mondial et ainsi que nos plans stratégiques nationaux de lutte contre le paludisme qui doivent, auxquels les notes conceptuelles doivent être alignées. Que ce soit des notes conceptuelles pays, que ce soit les projets menés par les OSC au niveau communautaire, nous devons nous aligner aux plans stratégiques nationaux ainsi qu'au en ce qui concerne la note conceptuelle, s'aligner au cadre modulaire du Fonds mondial. Maintenant, par rapport aux plans stratégiques nationaux, dans certains pays, on met de plus en plus en avant la médecine traditionnelle, mais pour le moment, ce n'est pas encore clairement défini dans le cadre modulaire et la prise en charge de la médecine traditionnelle afin qu'elle soit financée par le Fonds mondial. Mais c'est des éléments sur lesquels, comme disait Chris, il y a le renforcement du système communautaire, il y a le community-led monitoring, donc le suivi communautaire, qui sont des éléments financés par le Fonds mondial. Maintenant, il faut trouver le moyen de pouvoir peut-être joindre l'activité liée à la médecine traditionnelle au suivi communautaire. Donc, c'est à chaque pays, chaque personne qui peut de pouvoir définir clairement comment joindre les objectifs de son organisation à celles alignées par le pays ou par le Fonds mondial. Donc, nous laissons le soin à chaque organisation de faire cela. Et les outils développés et présentés, qui ont été développés et qui ont été présentés par Chris, seront communiqués, seront partagés avec tous les participants afin que de manière aisée, vous puissiez les consulter et voir quelles sont les activités ou interventions qui peuvent être financées par le Fonds mondial. Qui peuvent être financées par le Fonds mondial. Donc, n'hésitez pas à consulter les outils qui vont être mis à votre disposition afin de bien définir les interventions et d'utiliser ces interventions sur lesquelles vous voulez, que vous aimeriez qu'on puisse financer. Il y a une question de Marie-Laure. On va prendre 2 dernières questions avant de... Il nous reste à peine 15 minutes. On va prendre 2 dernières questions. Il y a la question de Marie-Laure qui n'a pas été bien soulevée. Qui n'a pas été bien... Marie-Laure avait un souci avec sa question. Je vais rappeler la question pour qu'on puisse la répondre. Marie-Laure demandait si le renforcement des capacités des institutions pour les OS est confronté au manque d'audit, de gestion, de certification externe des comptes et ces autres soucis. On peut procéder au renforcement des capacités de ces institutions-là. Et elle demande également s'il est possible d'inscrire ces points comme activité dans les demandes de financement. Car pour qu'une OS soit capable de mobiliser, mais surtout de gérer les fonds, nous pensons qu'elle doit avoir des capacités renforcées sur ces aspects. Marie-Laure, c'est ce que Chris a défini lorsqu'elle a pris l'exemple tout à l'heure, c'est qu'il y a cet aspect renforcement des capacités dans le module système de renforcement des systèmes communautaires. Donc, je pense que l'outil, quand il sera mis à votre disposition, vous allez voir vraiment quelles sont les interventions qui peuvent être financées. Et cette intervention liée au renforcement des capacités est l'une, si je ne me trompe pas, mais je pense que dans l'outil, c'est bien précisé, le renforcement des capacités est prise en compte comme intervention qui peuvent être financées. Nous avons également la question de M. Koné de la Côte d'Ivoire qui demande que est-ce qu'on peut revenir sur les coûts du CLM, étant donné qu'en Côte d'Ivoire, ces coûts seront partagés entre les récipiendaires RSS et les récipiendaires communautaires, VIH, TB et paludisme. Bon, monsieur connaît votre question, revenir sur les coûts du CLM. Je pense que c'est chaque pays qui définit ses coûts en fonction de vos objectifs. Donc, c'est pas, je sais pas, le facilitateur ne peut pas vraiment vous dire combien cela va coûter. C'est vous, en fonction de vos besoins, qui allez vraiment définir les coûts du CLM dans votre pays et savoir comment les répartir entre les différents récipiendaires ou sous-récipiendaires. Donc, il faut vous rapprocher de le comité de rédaction des notes conceptuelles, soit entre les 3 maladies, soit au niveau du système de renforcement communautaire, afin de définir vous-même au sein de votre comité de rédaction quels seront les coûts à attribuer au CLM dans votre pays. OK, je pense qu'on a plus de mains levées.
Oui.
Okay.
Just to add on to what you've said for Mr. Kone, if you go to the module command, you can find out, you can cost your needs as the malaria team, and then the HIV and TB will also cost their community needs. Those do not need to come together. You can still do some 3 different community-led monitoring interventions by disease or by population. The nature of community-led monitoring is that it's not M&D, so you'll choose something. You'll want to choose monitoring, for example, community barriers to specific prevention interventions. Then you will cost that in terms of, okay, entry to the community, planning, the tools, how you'll remunerate human resources, mapping of all the parties prenant. And then you cost it and give it to the CCM. And HIV will also do the same. TB will do the same for some key populations. And then they will decide which one stays. And in future, you can approach the teams, the technical team here, Impact Sante, for some integration. Whenever you feel like you need to integrate it, the CCM is also being encouraged to integrate CLM interventions in future into their oversight work. So for now, you can cost it separately as the diseases. In future, you can check for integration if possible. Thank you so much. Yeah.
Thank you so much, Chris. We take a last question from Soumaïla. Soumaïla, vous avez levé la main. On va vous permettre de poser votre question. Vous pouvez ouvrir votre micro pour poser votre question, Soumaïla.
Oui, Fidèle, bonsoir.
Bonjour, bonjour, mon cher Soumaïla.
Bonsoir tout le monde, comment que vous allez?
Bien, bien, merci. Allez-y, vous pouvez poser vos questions.
Ça va. Sinon, moi, ma question, excusez-moi, hein, je vous ai pris en cours, mais sinon, j'ai une question parce que nous, le week-end passé, on a fait un atelier par rapport aux écritures là, et c'est avéré que nous sommes en train de nous battre pour avoir des pierres communautaires, mais à chaque fois que nous posons ce problème, on nous dit que ces activités-là font partie du renforcement des capacités, du renforcement du système de santé. Parce qu'il y a une partie qui est dédiée aux aspects communautaires. Alors que dans les activités TB, bon, VIH et paludisme qui est en cours maintenant, parce que TB n'est pas encore là, on nous réfère tout le temps au niveau du système de renforcement de santé. Alors que même le montant qui est dédié au renforcement du système de santé, c'est vraiment pas quelque chose de grand. Alors que tout ce que nous sommes en train de faire sont dédiés aux communautaires. Est-ce que nous allons continuer dans ce sens ou bien avoir vraiment des activités spécifiquement focus sur les aspects communautaires? Parce que nous, comment dirais-je, la confusion que les uns et les autres font est qu'à chaque fois, on nous dit, surtout au niveau du ministère de la Santé, nous disent qu'ils travaillent avec les relais communautaires, alors surtout que les relais communautaires font des activités communautaires. Nous, c'est dans notre entendement, ce que nous faisons et ce que les relais communautaires font sont deux choses. Certes, des fois, quand nous faisons des activités, nous nous basons sur les relais communautaires, mais nous, on veut cette proximité-là avec vraiment la société civile. Maintenant, ma question est, est-ce que nous pouvons, dans les financements prochains, parce qu'on est à 2 jours de l'écriture, de l'envoi même de l'écriture, parce que la porte, c'est pour le 20 mars, est-ce que nous allons continuer à attendre ou bien peut-être avec le ministère, nous allons voir quelle formule nous allons adopter pour pouvoir vraiment atteindre l'objectif que la société civile s'est fixé. Parce que c'est un problème. C'est un problème qui revient à chaque fois, à chaque fois, à chaque fois, à chaque fois. Vous voyez? Et le ministère dit qu'il travaille aussi avec les radios communautaires. Pour nous, aujourd'hui, surtout le Niger, si vous regardez sur les 8 régions, la majorité des régions sont des régions qui sont dans l'insécurité. Est-ce que ces gens-là qui sont en déplacement ou bien ces gens-là qui sont en insécurité auront le temps d'écouter la radio pour savoir le moustiquaire là, qu'est-ce qu'on en fait, bien comment dirais-je, les réponses attendues à ce que les activités que nous sommes en train de faire, est-ce que ça va atteindre les objectifs?
Merci beaucoup, mon cher Soumaïla. Merci. Nous avons
Fidèle.
très bien suivi ton intervention. C'est vrai que c'est un problème assez récurrent. Un problème qui était récurrent dans les précédentes subventions où il n'y avait pas toujours alignement entre le financement reçu et les activités à mettre en œuvre au niveau communautaire. Je vais peut-être passer la parole au consultant Chris, à notre facilitateur Chris, pour qu'il puisse s'il a quelque chose à nous édifier là-dessus. Merci, Chris.
Yeah, what Sumaila, thank you so much for your question. What Sumaila is asking, yes, what you're asking is a problem that is all over the world. But from this NFM4, there are some basic tricks we have already started implementing. First of all, community-led monitoring is no longer community-based monitoring, and it is separate from M&D. So if you're implementing community-based monitoring, then there's no way the government can be involved in leading it. The government system stops where at the nearest facility, the smallest health center, that is the last place you see government. And after 6 o'clock, people go to their houses. That is where the community is. So the argument by government that they are working with le relais communautaire does not really get to where we want to be. First of all, number one, if one of the tricks that we use is the one I've told you, is CLM has to be completely government-led. Has to be completely community-led. You might talk to government, but it is an activity that is based, led, planned by communities. So the government has no argument there that they are implementing CLM. A lot of the other community work, even if the government might be doing it, sometimes it is the work of the communities. So always separate the two. Who is best placed to do it? Always separate between the two. But going forward, we'll be asking, if possible, for the Global Fund to insert or begin a system of pushing for a minimum of community interventions and community-led interventions throughout the grants. So this might not be a uniform process, but it could ask maybe the high-impact countries to do something, and that is one recommendation we'll be taking forward. Because we are noticing that when the money comes, government most of the time wants to take the big chunk of it, even when they don't need it. For now, please look at the annex in your funding request and ask the government, ask the communities to fill up. What did you want as priorities to go to the Global Fund, and what has been retained? And you fill up, and if there are some priorities you feel were not taken into account, indicate that to the Global Fund, and the proposal will be reviewed in that knowledge that some of your activities were missing. Yes, that is what I can say for now. So it's still not very late. You still have that annex to state what you think should have been in the funding request. Yeah.
Thank you so much, Chris. Merci vraiment à tous les participants qui ont posé les questions. Et pour toutes les autres questions, s'il vous plaît, n'hésitez pas à nous les envoyer dans le chat ou à l'adresse mail du secrétariat CSOMI. Cela sera envoyé, ces questions seront envoyées au facilitateur afin qu'on puisse apporter d'autres édifications aux différentes préoccupations. Sans plus tarder, je vais juste revenir sur un aspect très important qui est de rappeler pourquoi il est important qu'on puisse s'engager concrètement, nous, en tant que société civile et représentants des communautés vulnérables, dans le processus GC7 du Fonds mondial, surtout dans le cadre de l'élaboration de la note conceptuelle paludisme. Donc, c'est juste quelques points sur lesquels la société civile peut intervenir et peut appuyer le CCM de leur pays pour pouvoir participer à leur tour et faire participer les communautés affectées par le paludisme au processus. Donc ici, chacun d'entre nous, chacune de nos organisations peut participer, bien peut effectuer le renforcement des capacités des autres OSC ou des communautés affectées sur le processus GC7 en lui-même, afin de renforcer leur rôle dans le processus. On peut toujours accroître notre participation à travers notre présence dans les comités de rédaction des notes conceptuelles. Et il est de notre droit de demander à nos CCM à quel niveau se situe le processus de développement de notes conceptuelles. Donc, n'hésitons pas à chaque fois que nous avons l'occasion de pouvoir discuter avec les CCM, avec les représentants de la société civile au sein des CCM, de demander à quel niveau et comment est-ce qu'on prend en compte les priorités et les besoins des communautés affectées. Et concernant ces priorités, nous devons concourir à l'identification de ces priorités-là. Nos activités que nous menons au quotidien nous permettent de pouvoir être en contact tous les jours avec les communautés affectées par le paludisme et de savoir quels sont les besoins réels. Et il est de notre devoir de pouvoir remonter ces besoins réels jusqu'au comité de rédaction de notre conceptuel. Donc, n'hésitons pas à le faire et en remontant ces besoins, de l'accompagner par un fort plaidoyer afin que les besoins prioritaires de ces communautés soient vraiment pris en compte dans la note conceptuelle. L'étape vraiment essentielle et primordiale, c'est s'assurer que c'est jusqu'à la soumission, ces besoins relayés depuis les communautés affectées ont été soumis au Fonds mondial à travers la note conceptuelle. Donc, il est toujours de notre devoir de nous assurer de cela en faisant un suivi de proximité et nous rassurer que les besoins des communautés sont vraiment pris en compte. Car pendant très longtemps, lors des subventions passées, il n'était pas toujours aisé de voir les notes conceptuelles qui revenaient et où on constatait que moins de 30% des besoins émis par la communauté ont réellement été pris en compte. Donc, ne faisons plus la même erreur au cours de ce processus qui se déroule actuellement dans nos différents pays. Nous avons des pays de la fenêtre 1 qui doivent soumettre leurs notes conceptuelles au plus tard le 20 mars, donc au plus tard lundi prochain, qui sont dans la dernière ligne droite. Nous devons nous assurer que les besoins auxquels nous avons pu collecter, les activités, les interventions que nous avons définies et qui répondent et qui alignés au plan stratégique national de notre pays puissent être prises en compte dans nos conceptuels. Donc, c'est essentiel. Et cela passe par quoi? Qu'est-ce qu'on attend de nous? C'est de nous engager réellement dans le processus GC7, de pouvoir relever les différents goulots d'étranglement que nous rencontrons et pouvoir les partager rapidement avec les différentes OSC dans nos réseaux nationaux afin qu'on puisse trouver des solutions à ces goulots d'étranglement et surtout, comment adresser ces goulots d'étranglement. Ce sont les opportunités pour les OSC de vraiment s'engager dans le processus GC7 dans les pays respectifs. Donc, montrer à nos CCM, montrer au comité de rédaction des notes conceptuelles que la société civile est présente. La société civile paludisme est présente et est disponible pour pouvoir mener à bien le processus jusqu'à la fin en appui au CCM du pays, en appui aux différents programmes. Donc, ne laissons plus l'opportunité aux autres de faire ce que nous devons faire. Sans plus tarder, on va rapidement passer à l'évaluation de notre webinaire, tout en remettant une fois de plus Chris de la brillante présentation qu'il a faite et pour toutes les réponses qu'il a partagées avec nous durant ce webinaire. Nous avons juste deux petites questions qui vont être partagées par Mentimeter. Donc, nous allons partager le lien Mentimeter dans le chat box. Et vous allez juste cliquer sur le lien, là, ça va s'ouvrir et vous allez pouvoir faire le Mentimeter. Le lien est en train d'être ajouté dans le chat box. Donc, nous vous prions juste de cliquer sur le lien afin de pouvoir accéder rapidement à Mentimeter et pouvoir effectuer l'évaluation. Donc, nous vous prions de répondre. Je pense que le lien a été partagé. Nous voyons les premières réponses. Donc, n'hésitez pas à répondre aux questions posées. Merci, Zainab, pour ton appui. Donc, la première question est la suivante. En un mot, qu'est-ce que vous avez retenu de la thématique abordée lors de ce webinaire? Donc, qu'est-ce que vous avez pensé de la thématique sur le costing des activités de lutte contre le paludisme? Donc, nous attendons vos réponses. Nous avons déjà quelques réponses, telles que c'est plus instruit sur la place qu'occupe la société civile dans le DC7, la possibilité de relancer le Fonds mondial sur la non prise en compte de certaines interventions, et le devoir de suivi est trop excellent. C'est vraiment très bien. C'est vraiment ce qu'on attend de nous en tant qu'acteurs de la société civile, qu'on puisse vraiment faire ce suivi de proximité. Oui, la priorisation, très important, d'effectuer une bonne priorisation. C'est cela qui nous permettra de définir les activités éligibles pour la lutte conceptuelle et les budgétiser. OK, oui, les guérisseurs traditionnels, la médecine traditionnelle, oui, cela peut être pris en compte dans le cadre du suivi communautaire. Donc, il suffit pour chaque OSC qui a pour axe la médecine traditionnelle de savoir comment la proposer et la jumeler avec la partie suivi communautaire au renforcement du système communautaire. Dans le cas du renforcement du système communautaire. Oui, efficacité présente dans la société civile lors des réunions de planification, très intéressant. La prise en compte des activités communautaires de la société civile, oui, très important. Les méthodes de costing, oui, vraiment très intéressant. Nous attendons les autres réponses. Avant de passer à la dernière question, on va encore donner quelques secondes avant de passer à la phase de revue et négociation, oui, très intéressant. Et comme a dit le partenaire, c'est important d'aller jusqu'au bout. Donc, ne nous arrêtons pas en cours de route. Notre travail, notre devoir consiste à aller dès la phase d'initiation, telle que définie par CRIF. On a vu les différentes étapes. Et jusqu'au bout, la négociation et le grand making. Parce que le travail de la société civile ne s'arrête pas seulement à identifier les besoins prioritaires, mais nous sommes également actifs dans la rédaction de la note conceptuelle. Nous devons être actifs dans le suivi de cette note conceptuelle, dans la négociation et même dans la mise en œuvre de la subvention. Donc, n'hésitez pas à pouvoir poser toutes vos questions, à donner toutes vos réponses liées à cette question. La détermination des coûts, oui. D'impliquer les communautés. OK, oui. L'inclusion des communautés dans les zones dangereuses, exactement. OK. Merci beaucoup pour toutes vos questions. OK, on va encore laisser 1 minute pour qu'on puisse répondre à cette première question. OK, allons-y. La possibilité de prise en charge des besoins, renforcement des capacités, oui. Pas seulement en audit, mais il y a dans pratiquement tous les domaines de renforcement des capacités de la société civile. Je pense le module renforcement du système communautaire a détaillé de manière vraiment explicite les différentes interventions qui peuvent être financées en termes de renforcement des capacités. Donc, nous vous invitons vraiment à consulter le cadre modulaire qui va également être à nouveau partagé avec tout le monde, avec les autres présentations de ce webinaire. OK. La deuxième question, c'est juste une appréciation de ce webinaire. Donc, dites-nous quelle est votre appréciation générale du webinaire qui tire vers sa fin. Donc, nous aimerions avoir vos opinions sur l'appréciation, sur comment s'est déroulé ce webinaire. Est-ce que cela a été intéressant pour vous? Donc, n'hésitez pas à nous donner vos opinions afin de renforcer la qualité d'organisation de nos webinaires et aussi améliorer les petits couacs qui peuvent parfois déranger. Donc, nous attendons vos réponses. S'il vous plaît, utilisez le même lien juste pour pouvoir répondre à cette question. Et nous aimerions bien avoir votre appréciation de ce webinaire. Merci. Merci beaucoup pour vos réactions. Merci, nous attendons les autres. N'hésitez pas à donner tout ce que à donner votre appréciation, s'il vous plaît. Merci. Excellent, beaucoup d'excellent. Waouh, à renouveler. Adéquat, prompt. Très intéressant. Donc, juste une appréciation, c'est bon. Vous n'avez pas besoin de donner 3, 4, 5. Une appréciation, c'est bon. Ça va aller. Nous avons près de 60 participants. Nous n'avons que 8, 9 réponses pour le moment. Nous attendons la réaction des autres, s'il vous plaît. Thank you so much. Okay, we continue to wait answer from other participants. Nous allons encore attendre 30 secondes que les derniers participants puissent répondre. Merci déjà à tous ceux qui ont répondu aux 2 questions. Merci beaucoup. Merci vraiment à tous ceux qui ont pu se connecter ce jour pour notre webinaire.